about the radiation?
What the hell is that?
I have no idea.
What on earth is that? My professional medical opinion is that she's been afflicted by the slug vomiting charm. Let's work on the distant possibility it isn't that though. What else could it be? Very excited to be reacting to House MD Season 2 Episode 23, Who's Your Daddy? On this channel we are reacting to all 177 House videos. This will be episode 65. Let's see if I can get the diagnosis before House does as a doctor working in London.
It was all a lie. I never knew you were my dad.
Glad I'm getting this chance.
We gotta go! Get out of here!
Leona!
I'm glad that was a hallucination, as I've never seen a death certificate with a valid cause of death written as toilet tidal wave. Sounds like there have been some changes in this girl's life recently. Her mom died and she never knew her biological dad, who is now probably taking her into his custody. What could that mean? Maybe whatever killed her mom is also affecting her. It's also clear she's hallucinating, which probably led to extreme stress, which triggered her heart to go into a funny rhythm and her to pass out. If I saw this patient on a plane, I'd want to take her blood pressure urgently and see if this abnormal rhythm of the heart is stable or unstable. If it's unstable, you'd consider shocking her, especially if you don't feel a pulse. We're in the ChatGPT age though, so modern automated external defibrillators will actually tell you when a shock is needed as long as you attach them in the right way. So many things can cause these hallucinations, so we'll wait to find out more first before running a differential.
And is no longer in service. If you feel you've reached this recording in error.
House, pick up. I've got a case. 16-year-old girl presenting with cardiogenic shock. No heart attacks.
House is reaching breaking point right now on his day off and has gone for the morphine straight into the vein, as his Vicodin isn't touching the pain anymore. The thing is, he doesn't need to inject it into the vein. He could take Oromorph, which would be reasonable, so this is clearly getting to abuse levels. Going from Vicodin to IV morphine is like going from Little League Soccer to the World Cup. Except you're playing on your own and scoring a goal is peeing your pants and becoming unconscious. Incredible to see though that hearing about the case from Cuddy made House stop and think for a minute about what he was doing. It provides an interesting point. Where would House be without his job? You see, with the Andrew Tate and Grant Cardones out there, a massive push online recently has been to shame people with jobs for being brokies. It is true that for some, starting a business could be the right thing and be a net positive for mankind. For others though, having a job provides them with safety, activity, intellectual stimulation, a feeling of self-worth, and a place to meet friends and socialize. You can definitely see the benefit of a job looking at what just happened with House.
Talk screen's clean, blood shows no infection. Guy who brought the girl in says he knows you.
And I'm her father.
I don't believe it. Sucker. You always were.
An arrhythmia.
What are we gonna do? Keep her in a room on a cardiac monitor till she has another arrhythmia?
I happen to know she's gonna have one right after lunch. Blow your nose. I need DNA from somewhere.
If I let you do the test, it means I don't trust her.
No, it means I don't trust her.
Interesting, so this patient's father knows House from somewhere, but they're being very secretive about where. The look on that guy's face though makes it seem like it's from Jeffrey Epstein's list. So what do we know about the patient so far? We know blood tests show no infection, toxins were negative, and her ECG or EKG is also negative. House is absolutely right that a heart that's prone into going to abnormal rhythms can look normal most of the time, but still not be. If you sometimes get the feeling that your heart is beating or fluttering, then you know that doesn't happen all the time. That fluttering could be normal or related to anxiety, or that your heart is actually going into an abnormal rhythm. Things that can cause that include excessive caffeine or alcohol consumption, stress, high thyroid hormone levels, electrolyte imbalances, or an innate problem with the conduction system of the heart. If someone comes to us with that, the most important thing we do is a 24-hour tape. That's when we monitor the heart signal over 24 hours and ideally catch what the heart's electrical signature looks like during an episode. Believe it or not, Apple Watches can be very useful for this. I once had a patient in A&E tell me that he felt fine, but his Apple Watch was alerting him to seek urgent medical attention, and his heart had been going at 200 beats per minute while he was watching TV, which is exorbitantly high. A normal heart rate shouldn't go above 100 at rest. I wouldn't rely on an Apple Watch as much as a formal 24-hour tape though, as the trace isn't as good and it can sometimes give some false alerts when there's no problem. Seems like House wants to skip the waiting part though and just induce the arrhythmia himself. It's a miracle none of these procedures end up with his patients dying. It's like a child who keeps ignoring your instructions and never gets hurt.
Send the first electrical pulse.
Sinoatrial node is normal.
Next.
Got supraventricular tachycardia.
Is she hallucinating?
No, normal waves.
All that was a heart attack. Reset her so we can find the real problem. Right atrium, please.
That's the one. She's hallucinating.
Seems like they're doing the detection part of what we call an ablation procedure. Similar tests exist for certain kinds of arrhythmia syndromes like Brugada syndrome, where they use a medication called adrenaline or sometimes even adrenaline when we're getting really adventurous to induce the arrhythmia. This is much more direct though, finding the area of problem tissue and getting rid of it. Seems like that is in the right atrium, so what does that mean? Well, Foreman is monitoring the brain trace, and so Chase stuck the electrode there. That seemed to trigger the same arrhythmia that was there on the plane. If the heart were an electrical circuit, then the battery, which is the sinoatrial node, sits at the top of the right atrium. What can cause the node to become dysfunctional? There is a condition called sick sinus syndrome, where that metronome that keeps the beat just decides to stop for a few seconds and then start again. It doesn't cause these hallucinations that we've seen though, so we'd still need some more info before diagnosing her. But a question for you smart people: does the heart keep beating when taken out of the body? If so, why? Answers down below.
Damaged heart muscle gone. Cryoablation complete.
EEG's back to normal. No hallucinations.
Hello? I just need some water.
Mama?
I thought we were watching House, not The Sixth Sense. Either way, it seems this ablation procedure they were doing didn't quite hit the spot, or it's not coming from the heart at all and this is just a coincidence. Visual hallucinations are a little rarer than auditory hallucinations, and the fact they keep coming back means there's definitely something spicy going on. So what could this be? The episode title is Who's Your Daddy? And the original dad probably isn't the dad. If we assume that she inherited whatever disease she has from her father, then it has to be non-sex hormone related. That's because females have 2 X chromosomes, so they have a spare copy from their mother in case their father's gene gets defective. Or maybe it was related to her rough lifestyle. Apparently her mother suffered with addiction early on in life. Maybe she was overly exposed to rough or dirty environments in that case. I mean, a metabolic cause of this could be hemochromatosis, which is also genetic. Maybe her long lost father has the disease and so finding him would give the answer. If that's the case, then her liver should start failing soon. That's worth my first diagnostic guess. Autoimmune could be lupus, which is more common in Afro-Caribbeans, and again, father could be affected, although it's way more common in females. I'll give that my second diagnostic guess. Degenerative could be Lewy body dementia, but unlikely and only a small genetic component. Cancer could be the cause as well, but how would the heart be related? And they would have picked it up with the MRI unless it's somewhere else in the body. Infectious could be HIV that she got from her mother, or toxoplasmosis, or herpes encephalitis, enterovirus, or even mosquito-related viruses like West Nile, but very rare and don't quite fit. Toxic could be heavy metal poisoning like copper or mercury, although again, atypical symptoms. I definitely want to know more about her history and where she's been hanging around recently to narrow it down.
What if her hallucination was caused by pain? She needs a PET scan, proving that her hallucinations are a consistent response to pain, which proves that she has an autoimmune disease.
How do you test someone's response to pain?
Hurt them. You know he's not your father, don't you?
She's hallucinating.
Most of the time, House sends his staff to do his procedures for him, but not this time. House looked like he enjoyed that way too much. I guess he was right though, except what was that small thing called the Hippocratic Oath that we took based on? Primum non nocere, first do no harm. What is more harm though, letting a patient die from her condition or some temporary finger bending and face melting. I guess he got consent for it, but there are actually limits to consent. This one's not for the faint-hearted, but there was a case in Germany about 2 decades ago of a guy named Armin Maiwes who seemed like an ordinary computer expert until the 42-year-old killed and ate another person. What's strange about the case though is that the victim, Brand Brandes, agreed to this whole situation. The two met up on an evening in Maiwes' house, then Brandes took a bottle of sleeping pills, half a bottle of booze, and then had his crowned jewels removed, which they then consumed. I won't go into many details as it's a pretty gruesome case, but Maiwes ended the victim's life and was caught by the police shortly after. 2 significant problems the police had though. First, cannibalism isn't illegal in Germany, and second, the victim was caught on tape consenting to the whole agreement. He was only sentenced to life in prison in 2006, even though the incident happened in 2001, because it took them ages to end up ruling that the consent was invalid, as the victim was seen to be suffering from a psychiatric condition at the time, invalidating the consent. Thankfully. Absolutely insane case that makes me sick to the stomach every time I hear about it. Anyways, according to House's theory, the fact she had a hallucination means she could have an autoimmune disease, so maybe my lupus guess is gathering traction. Let's find out.
We don't even know which autoimmune disease she has.
Let's kill them all at once.
The only way to do that is replace her entire immune system.
Let's do that.
Bone marrow transplant requires an exact match.
They don't itch, not raised.
Get a new couch? What color is it?
Red.
Need you. Now, part of the protocol for in vitro fertilization is twice daily injections of minotropins. I can't do it myself.
Look at House's face! He's wondering, have I been around my patient for so long that I'm hallucinating now too? Except these are different kinds of hallucination. So much to go through here, otherwise House's pain experiment has somehow confirmed autoimmune disease, but he doesn't know which one, so he's decided to cure them all by simply trashing that useless piece of junk called the immune system and replacing it with a new one. Believe it or not, this has actually been done as a disease treatment before. It was mainly started by the observation that patients who had both a blood cancer and an autoimmune disease had both cured at the same time when having a bone marrow transplant and resetting the immune system. This is a very risky approach though, and even though it's been offered to some patients with severe autoimmune disease, they have a chance of death of 20% from the procedure. That is a lot when there are other less risky options to try first, like immunosuppression and steroids. Not sure why House isn't trying one of those diplomatic options first before going for the nuclear launch button. But he does all of this craziness, risking his medical license for our viewing pleasure. What a hero.
You don't want to make the first plastic cup that buys you a drink.
I'm pretty sure you got that. Ow. Thanks.
So why were you friends with this guy?
He had a car. If he'd been a woman, I would have married him. Stop the radiation.
What the hell is that?
I have no idea.
What on earth is that? My professional medical opinion is that she's been afflicted by the slug vomiting charm. Let's work on the distant possibility it isn't that though. What else could it be? Well, she wasn't coughing, so it's not phlegm. She also didn't actively look like she was vomiting, but it can be subtle sometimes and only work internally, so it could possibly be vomit. It could also be discharged from an infected wound in her mouth, but they definitely would have seen that by now if that were the case. How could any of that be linked to getting your bone marrow irradiated though? That's still a question mark. If you love solving the brain teasers that are House episodes with me, then check out the channel membership. You get priority access to new videos, access to exclusive polls, and to suggest another series and episode for me to react to. The first 30 members have a chance to win a 1-hour one-on-one tutor session with me on a topic of your choice. We currently have 25 members with just 5 spots left, so press join to secure your spot. I'll keep working tirelessly to make it worth your while.
She pooped out of her mouth.
The sample contains stool and digested blood. How did you guess?
Because it oozed. Oops, we were wrong. Because no autoimmune disease shuts down an organ in 2 hours. We need to do a liver biopsy, find out what the real problem is.
There are so many problems with what House just said. It's like the writers were in the room with the doctors planning this episode and said, look, we need to be able to say she pooped out of her mouth. Why? For the drama. I've seen people actually vomit poop from their mouths, and trust me, it does not look like that. It's violent, it's aggressive, and it's horrible. I wouldn't wish it on my worst enemy. And it also doesn't happen because of liver failure. The most common cause is bowel obstruction. That stops the feces from going down, so it has to come back up. So how do we treat that in real life if it happens? Surely we can't just leave someone tasting their own poo. Well, we insert what we call a nasogastric tube down into the stomach, and that helps us suck out all that nasty fluid before the patient would have to vomit it. When I was on the gastrointestinal ward, I saw a 31-year-old patient with inflammatory bowel disease that was draining 3 liters of black fluid in just 1 day. I'm definitely not convinced by this liver theory.
Stop the biopsy. Please tell me you didn't stop the biopsy to play us some tunes.
Left hand. It's very subtle.
Ask for this tune.
My God, Grandpa was an angry drunk. If only we'd known.
That note that he says is out of tune. It's not. Which means that something is screwing with his oral perception too.
Too much iron. He could have had hemochromatosis. That's genetic.
No way. If it is hemochromatosis, then I got that insanely early. So House somehow got that the patient's grandfather that was playing the music had personality and hearing changes just from listening to the tape. I've seen House use knowledge of ants, Mexican clay pots, and ancient Egyptian alchemy in just the last few episodes to help him solve cases, but I didn't realize he had perfect pitch as well. My music knowledge consists of me playing the Titanic on the keyboard. So sad. So what is hemochromatosis and why do we think that could be a good call here? You already know that it's a genetic mutation that causes the body to absorb excess iron, but what does that do? Well, it starts to deposit in your organs, classically the liver, skin, brain, and heart. It can cause chronic fatigue, psychosis, liver failure, heart failure, diabetes, joint pain, and skin changes like making people look permanently tanned. Maybe that's why she doesn't look like her dad. Treatment would be with something called chelation that binds to the excess iron and lets your body get rid of it. The classic one we use is called desferrioxamine, and it works by enveloping the iron. You can test iron studies to get an indication of if there's overload, but to truly confirm it, you'd need to run a genetic test, which could take a couple of weeks. Maybe House will come up with another way, like his unconventional autoimmune test to test her though. Like if he punches her in the face and she kicks him in the nuts, then that means her iron's too high. Let's find out.
This is a photograph of Leona when she was 13 years old. She's darker now. No tan line. Treat her with deferoxamine. She'll be fine by lunch.
There's the iron. Lots of it. Should be quick and painless.
Not getting any air.
What on earth was that animation? So Chase gives the iron binder, it goes into her blood, then blood starts making holes in the blood vessel that let light in like they're in an old straw roof. The design of that animation may be surprised to hear that, believe it or not, inside blood vessels there is blood. So when you make a hole in one, then you don't just get a lovely summer glow shining through, you get high pressure blood spraying out at maximum velocity. Either way, what on earth is going on and why can't she breathe? Maybe it wasn't iron overload. What if it's actually microinfarcts in the liver because of sickle cell disease? It's genetic, it can cause multiple crises and hallucinations, and it may cause a bit of a twist on the daddy front. I'm gonna go with that as my third and final diagnostic guess.
CT showed her lungs are Swiss cheese.
Her waist system is a little screwy right now. Means the iron can't go where it wants to go. What if it moved to her lungs? What likes iron?
Fungus likes iron.
Get her on a voriconazole drip and hope she has aspergillus.
What on earth? We're in the territory of a subspecialty of a subspecialty. Hemochromatosis and aspergillus infection. Now, we know that this fungal infection does affect the lungs of vulnerable individuals who have cystic fibrosis or are immune suppressed or had tuberculosis in the past. We also know that aspergillus loves iron more than House loves giving Cuddy her fertility injections. There have been multiple studies that have shown patients with iron overload are about 9 times more likely to have aspergillus than those who don't. Their explanation then here is that the chelator carried the iron to the lungs, then aspergillus somehow magnetically pulled it through the blood into the lungs. There is no way that's possible. This is another one of those pooping from the mouth scenes where the writers just overpowered the doctors. Makes for great television though, and either way, they're pumping her full of antifungals, so hopefully it gets working.
I'm tired of looking. Ow.
Genes matter. And someone you trust.
Someone like you?
Someone you like.
Oh, sorry. Okay.
I rub his leg.
Leona's lungs collapsed. Treatment's not working. We've got the wrong fungus.
He stopped. She ruined it.
In case you're wondering why House is R-rated, now you know. Interesting that House was saying about choosing the sperm donor that you know and trust. Reminds me of my training on respiratory medicine. Two of the consultants, called attendings in the US, were in separate lesbian relationships and wanted a sperm donor. One anaesthetist ended up being that donor to both of them, even though they worked together. Pretty unique dynamic. What's more important than sperm though is figuring out what this fungus is. Other respiratory fungi that love iron include Candida, which usually cause thrush, but also could be some rarer strains like Trichosporan. If that's the case though, then technically voriconazole should have annihilated this. I'm very impressed though that the team wrote this episode. We also got a bit more story about how House knows this guy. Apparently he seems to have stolen his friend's girlfriend who wasn't treating him very well anyway, so he apparently saved him from her. Typical House move.
Just blink if you understand me. Fantastic. Did you lie to Crandall?
Recording studio. Soundproofing. Absorbs sound, also absorbs moisture.
Zygomycosis.
Start her on an IV drip of amphotericin B with colony-stimulating factors. She'll be fine by dinner.
I have to admit, I've never heard of zygomycosis before, so I needed to look this one up. It's a life-threatening, invasive and opportunistic fungal infection. The infected spores fly around in the air and are inhaled and can affect a vulnerable host as they use iron as a growth factor. Patients affected with conditions with higher iron load are more likely to be affected, like diabetic ketoacidosis, end-stage kidney disease or hemochromatosis. Usually it affects the nose, which can cause bloody discharge. In the lung form tends to happen in patients with leukemia though, and the nasocerebral form is more common otherwise. It can be so invasive that some patients even need it to be cut out surgically to fully cure it. Crazy that the patient lied to House's friend about him being her dad and went all the way to his recording studio to try and make sure she had a convincing story to back up.
Thank you for the injections.
I ran a paternity test. He is your dad.
House, you there?
Whoa, House's old friend wanted to be a dad and House let him live in his fantasy, even though this daughter was actually lying to him. I know it seems like the humane and sympathetic thing to do, but is it really? What happens when he finds out in 10 years after he's invested a decade into raising a child that he thought was his, but isn't? Or maybe House just told her without telling his friends so she would know and not steal his money and run. Either way, I got one half right, so it's the first ever draw between me and House. Interesting episode, although there are better ones in the series. 6 out of 10 entertainment, 6 out of 10 accuracy, I'd say 7.5 out of 10 diagnosis. This episode only makes sense though when you watch the previous one where a mother has no takebacks.